Hi, my name is Skylaer Palacios, and for those that don't know me, I am a council member in Healdsburg, California. On November 1st, the Healdsburg City Council decided that residents must be vaccinated to attend meetings. I held the only dissenting view on this item. It was not voted on, and there was no public input. I was put in a position where I felt I had to disclose my vaccination status due to the fact that my fellow council members were in favor of requiring proof of vaccination to attend meetings in person, with a virtual option for all others. I am now attempting to make my viewpoints clear on why I have chosen to not be vaccinated. I am saddened that we are severely divided on the issue of COVID-19 vaccines. At this point in time, I believe most people who are sure about getting vaccinated have likely done so, and I hope my viewpoints can shed light on why many others in our community and nation are hesitant or refuse to get vaccinated. I do think vaccines are an effective tool to help alleviate the pandemic, but I believe strongly in personal choice. I also have a hard time supporting something that I myself have not taken. I believe that is disingenuous. What encompasses the majority of the reasons I've chosen to not get the COVID-19 vaccine is simply that my questions related to the vaccines have not been answered. And at this time, many of my questions are not able to be answered. I question major media, I question the government, I question the pharmaceutical companies, and I believe asking questions relating to personal and public health is important and necessary. The data around COVID-19 vaccines is still being collected and analyzed every day. There are many variables in clinical trials versus the data collected from the general public. I am not a doctor, clearly, but I do my own research when it comes to decisions I make about my health. I choose to acquire most of my information directly from the CDC and FDA websites. I follow them closely. When COVID-19 vaccinations first became available, it was clear that they were only conclusively proven to reduce the risk of hospitalization and death from the virus, so I did not understand the media frenzy that ensued about protecting those you love, before it was really known how effective the vaccines were at reducing transmission. Now it is known that yes, they are effective, but they still do not know how long immunity lasts after receiving the vaccines, which is a variable of efficacy. If you search the phrase, "How long does protection last?" on the CDC site, it will say, in their frequently asked questions, "It is not yet known how long COVID vaccine protection lasts." Recent studies show that protection against the virus may decrease over time. I also find it strange many top health officials claim as much as 100% of people need to be vaccinated to achieve herd immunity. If you search key things to know on the CDC website, they discuss population immunity and say, "We are still learning how many people need to be vaccinated against COVID-19 before the population can be considered protected." There is a clear lack of cohesion between the media and what the CDC and other public health officials are saying. I spoke to my doctor, and she said I have a very low risk of being hospitalized or dying from COVID. I have a known allergy to some pharmaceuticals, and I felt I had to do an extensive amount of research to feel safe taking the vaccine. An initial analysis of allergic reactions published in the Journal of the American Medical Association showed that 20% of people in the sample group who experienced an allergic reaction to one of the mRNA vaccines had the same allergy I have, which was the most common previously known allergy. I cannot get a medical exemption because my allergen is not stated in the list of ingredients. Because these vaccines are patented, the pharmaceutical companies are not required to list all ingredients as they are considered trade secrets. With so many details still inconclusive, in addition to the long-term effects unknown with a never-before-used vaccine technology, I am not willing to take the vaccine. There are too many unknowns for me, so personally, I cannot be sure if the benefits outweigh the risks, but I will continue to seek out reliable information. Proponents of the vaccine sometimes regurgitate the media phrase, "follow the science." I asked a few highly intelligent people I know who took the vaccine when it became available to them, and I was shocked when they told me they did not read the CDC, FDA, or vaccine provider websites prior to receiving the vaccine. Now that I see how highly politicized, emotionalized, and divisive this issue is, I understand why many people did not. People are being rushed and now forced to make decisions about their health, and people are confused. I think about the countless number of people that did not want to get vaccinated, but felt immense pressure and fear of losing their jobs and their livelihoods, feared not being able to travel or not seeing their loved ones. Due to this, I have serious concerns regarding the informed consent process of these vaccinations and the more recent mandates. Many people have questions, and as I said, many of these questions are still unanswered for myself and others who have waited to get vaccinated or refuse to. Do you think it is okay that we are dishonorably discharging soldiers or losing first responders for not getting vaccinated? Do you think it is okay that we are losing healthcare workers who choose not to get vaccinated in a time when we need them most? Do you think it is okay we are losing teachers and other school staff after our students faced one of the most chaotic years in public school history? These are the people who heal us, who protect us, and who teach us. If they are waving red flags, we need to listen. Do you think it is okay that a contingent mandate for our children to get vaccinated came before the vaccines were approved by the FDA? Is the science leading the politics, or are the politics leading the science? Once you learn who is funding the CDC and media corporations, are you wondering about inherent conflicts of interest? I hope so. Something is greatly amiss, and if you do not think our freedoms are at stake, I strongly disagree. This state of emergency has lasted almost 2 years, and what is extremely concerning to me is that none of us know how much longer it will last. Though most media corporations do not critically question this or cover anything that falls outside of their status quo. For example, I addressed the journalist that wrote the article in the Press Democrat. He asked for my comments, and I declined. I said I did not trust that my story would be told accurately and in totality. This is due to the fact that the media has convinced others that unvaccinated people are little more than selfish idiots. He said in our text that he later shared without my consent, "Believe me, I hear from annoyed pro-vax people who didn't think I should give the unvaccinated any forum whatsoever. When if it is really in the public's interest to vaccinate everyone versus those who need it most, others should want to listen to the concerns of unvaccinated individuals so we can collectively come up with answers and solutions." I asked him why he failed to mention in his article about Cardinal Newman the week prior that the students who acquired COVID were both vaccinated and unvaccinated. He said, "Great point on Cardinal Newman. I wish I had. That story came together very fast, and vaccination wasn't a key element of the article." I question how vaccination is not a key element in any article regarding COVID, especially when many parents are still grappling with the decision whether to vaccinate their child or not. Should the journalist amend the article to include that critical piece of information? I would say so. But I have noticed that anytime anything considered negative about the vaccines is found, even scientifically, it is often not given the same level of validity or media coverage. When researcher Dr. Jessica Rose had a paper published on myocarditis related to the vaccine reactions in children, she had her paper temporarily pulled from publication, and it was not due to false information or a bad peer review. Because of these observed media biases and the now chaotic state of both the CDC and FDA after several of their top health officials stepped down, I am going to look for other sources from experts such as Dr. Robert Malone, who helped discover mRNA technology, or Dr. Geert Vanden Bossche, an expert virologist. They do not agree that everyone should be vaccinated, stating that the response should have targeted the elderly and others that are more susceptible with underlying health conditions globally. They agree that vaccination cannot and will not be the only solution to ending the pandemic, and they acknowledge that those who have recovered from the virus should be included in the total percentage of those that are considered immune. Countries with high vaccination rates, such as Israel, are still grappling with high cases and surges. There is still no scientific consensus on the percent of people needed to be vaccinated to achieve herd immunity, and it is unethical to force everyone to get vaccinated. Spiritually, I know in my heart that something is very wrong with the direction society is going, and my first reaction is to resist the unknown as it pertains to my body. Though it was at one point considered a conspiracy theory that the virus was created in a lab, on May 26th of this year, President Biden called for an investigation into the origins of the virus. Still, nothing is conclusive. I have extreme unease with the idea that if I take the vaccine, risking a possible allergic reaction, I would be electing to have my body create a spike protein to a virus that may not be naturally occurring. That is something I need to know, and there is not yet an answer. I trust Creator to guide me, and I know in my heart that the only people who should have a say in any decision I make related to my health are my doctor and myself, not the media, not the government, not my employer, and not pharmaceutical companies. I took an oath when I went into office to protect the Constitution, and I have to oblige. The Ninth Amendment acknowledges that there are rights not explicitly stated in the Bill of Rights that we still have, and I undoubtedly know that this includes medical freedom and autonomy over your own body. Unfortunately, many elected officials do not have that same interpretation of the Constitution, and now our democracy is at stake. I already do not trust pharmaceutical companies providing the vaccine due to their history of having billions of dollars worth of litigation and fines they are required to pay due to their wrongdoings. As it stands, under the PrEP Act, these companies have total immunity from any liability around unintended side effects of their vaccines. In my personal experience, my grandma, who is a Black Dominican woman who worked for a hospital her whole life, died after several different doctors prescribed her fentanyl within a 24-hour period. When I found out some doctors get paid every time they prescribe opioids, I absolutely questioned the purpose of their medical tactics. I also learned just this year that the insurance company Aetna is the same company that paid slave owners for their lost investments once slaves were freed. This is the insurance company my family had for most of my life, and a company the government contracts with to provide insurance for many federal employees. So my family has been paying the same entity to oversee our health that paid slave owners for their lost investments, as if Black and brown people were chattel. I was sickened when I learned this. They were never held accountable. Accountability is not merely acknowledging a mistake, but taking a sincere effort to right wrongs. There has been no real accountability over the harm the government and the medical industrial complex has caused to communities of color, veterans, disabled persons, and many others. If they are historically not held accountable, they have given me no reason to believe that they truly care about my health. This is one of the reasons, I imagine, why although many BIPOC were affected disproportionately by COVID, there is also a disproportional amount of BIPOC that refuse to be vaccinated. This is part of the reason why I know that asking people to prove their vaccination status to enter buildings or access essential services is discriminatory. As someone that has faced discrimination based on gender and race, I can tell you that there are many similarities in the way that unvaccinated people are being discriminated against and stereotyped, though it is not the same. I have a choice to be vaccinated. I do not have a choice of being Afro-Latina, and I cannot change the prolific history of medical injustices, both purposeful and accidental, against marginalized people, and that is reflected in my choice to not get vaccinated, though only one of many reasons. I have already been denied entry into buildings, and now I will not be able to enter Healdsburg City Hall during our council meetings unless my colleagues can understand the injustices that they are perpetuating. In all transparency, part of my decision to run for local government is because I have valid reasons for not trusting the government, as do many others. I trust myself to be an agent of change in this brittle bureaucracy, and I have hope that we can course correct our political atmosphere to be one of compassion and empathy. Trust is earned, and whether it's the government, the media, or pharmaceutical companies, none of them take real accountability for the harm they have caused to significant portions of our society. This overt disregard for human life is still seen and felt today by many, and it has created a profound distrust of these entities across many demographics. I believe my purpose during my term on council will be to continue uncovering these injustices and help reestablish trust in our government, though this will not happen until accountability is met. Again, I am not trying to convince anyone to not get vaccinated. That is not my place. I am disclosing my reasons for not being vaccinated because I know I'm not the only one who feels this way, and I hope it brings clarity to those that may still not understand individuals' reasons for not being vaccinated. As a public official, I hope others are empowered to do their own research, look at historical patterns, and question popular narratives. I do believe we can figure this out together with more compassion and open dialogue. We will have opposing views, and that is normal, but no one should ever be afraid to speak. I hope to empower others to stand up for what is just. I know this is hard, and many lives have been deeply affected. Though the state of our world is in disarray, I try to have faith and rest on the idea that things unfold as they should. Thank you for listening. Again, my name is Skylaer Palacios, and I am a Healdsburg City Council member.